If you're on Medicare or you're helping someone who is, then you need to hear this. There's a new study out from Health Affairs that just confirmed what many of us have suspected for a long time, and that is Medicare Advantage plans are denying a significant number of claims. Even when they get overturned, providers are still losing money because of it. Hi, I'm Christopher Westfall. Today we're breaking down this study, but first, someone's having a birthday. I have a lot of stuff to cover today, but I want you to see this video clip from none other than Dr. Oz, who's celebrating his 65th birthday and telling you when you turn 65 what you need to do to get on Medicare.
I'm lucky. I've got a whole squad of Medicare pros around me to answer my, wait, where do I start? Or do I have to do something questions? But guess what? You got the same dream team at your fingertips. Yep, 24/7 access to the official experts. You can start at Medicare.gov or just call the crew at 1-800-MEDICARE. They are the best in the business, and I promise they will not end a conversation with, okay, boomer. If you're hitting the big 6'5" like me, and hey, there's a whole generation of us, depending on your situation, here's something you should know. Already retired and collecting Social Security? Well, you get signed up for Medicare automatically through Social Security. Watch your mailbox for a new Medicare card and information packet about 3 months before your coverage kicks in. Just remember, you still need to make some decisions, like if you're interested in a Medicare Advantage plan, and you got to make sure to see if you need drug coverage. Spoiler alert, you probably do. If you're still working, like me, you need to make some choices about when to enroll. There's no one-size-fits-all here. Medicare.gov me to answer my...
Here it comes. It's going to be interesting. Watch.
Wait, where do I start? Or do I have to do something questions? But guess what? You got the same dream team at your fingertips. Yep, 24/7 access to the official experts. You can start at Medicare.gov or just call the crew at 1-800-MEDICARE. Find what works best for you, including how Medicare works with the coverage you have with your employer. Now, since you're still working, you'll need to head to SSA.gov to enroll in Medicare. It's not automatic. Stay on top of deadlines. I mean, seriously, if you skip signing up for Medicare Part B or Part D and don't have other coverage, like through your job, you could get hit with a late enrollment penalty. We're here to make sure you avoid that. Bottom line, we got your back. Go to the official source, Medicare.gov, for info, tools, and answers. Or do what I did and just call 1-800-MEDICARE to talk to a real live human who really knows their stuff.
Okay, so he wants you to go to Medicare.gov for all of your answers and all of your questions about Medicare, right? Congratulations on turning 65. However, that might not be the best solution for you just to go to Medicare. Well, let's take a look at it. Let's say you go to Medicare on their website and you got a choice here. It'll ask you if you want to be on original Medicare or a Medicare Advantage plan. Now, he was just pushing only one option. If you heard him, he said that's where you can get your Medicare Advantage plan. Well, let's look. Here are the options presented on Medicare.gov. You can do Medicare Advantage. It's option 1. You can do just a drug plan or the one that no agents will tell you about unless you have a really good one, Medigap as an option. Well, let's just explore the Medigap option since Medicare Advantage is the one that's pushed by everybody so much and all over the television. Here's what you get when you look at the Medigap options. You get a whole bunch of plans with not much explanation. And then let's just say you want to find all the plans out there, all the companies that have a particular plan type. Once you've figured out on your own which plan type might be best for you. Sure, it'll show you companies and ranges of premiums. But then, as it says on the bottom there, costs are estimates and they may change. See, the reality is they have no idea at Medicare.gov how to sign you up for a Medicare supplement or a Medigap plan. They have no idea. The only plan that they will recommend to you and the only plan they can sign you up for is Medicare Advantage. Now, let's say that you want to look into Medigap because somebody on the interweb maybe told you about Medicare supplement as an option where you can stay on original Medicare that you paid into for your whole life and have the freedom of no networks, the freedom and flexibility of no referrals required, no prior authorizations required, no restrictions on where you go. And boy, you're going to be interested to see the study here in just a minute that just came out about all that Medicare Advantage junk. But wait, there's more. They're going to say if you want a Medigap plan, then you need to do what? You need to go to a SHIP counselor. Now, a SHIP counselor, it's a nonprofit organization funded by the government where volunteers look over plan options. Now, look, let me just say this caveat first. There are many, many great SHIP volunteers, and I appreciate what you do, trying to help people for no compensation whatsoever, and trying to be unbiased in the opinions that you have and the advice that you give. This is not an insult to SHIP counselors, because many, many SHIP counselors refer people to my agency to actually do their enrollment. So I'm not saying they're bad at all. But when Medicare says you should call the SHIP counselor, there may be more to that story. Well, what's more to the story? A study came out and said that the accuracy provided by SHIP counselors is sometimes subpar. Well, what exactly did the study show? Well, I broke it down for you right here. It says that a significant portion, only 39.9%, of attempted encounters with SHIP people, let's say you reach a SHIP counseling office, 39% attempted counseling could not be completed because shoppers never got a return phone call. Do you like not getting a return phone call? Fewer than half, that's 44.8% of the counselors, ever mentioned the possibility of a dual special needs plan for those people who are eligible. What does that mean? If you're very low income and you could qualify for Medicaid and Medicare, boy, the important distinction between the two will come up in just a minute when Dr. Oz is shown not having a clue what the difference of these two things are. But I digress. I'll show you that in just a second. If you qualify for both Medicaid and Medicare at the same time, you could get a special plan with even enhanced benefits. Still the restrictions of Medicare Advantage, even a smaller network in some cases, but SHIP counselors don't even tell people about that in 45% of the times. And then here's the most important one. It's difficulty with the accuracy. The percentage of accurate and complete answers provided by counselors was 40%. 40. The accuracy of responses varied depending on the question, with better performance on general questions and weaker performance on specific plan details. There's a difference here, and there's always been, I mean, just think about it, a difference between a volunteer and a professional that studies this stuff for 40 hours a week, has to get certified by all the industry training organizations and the carriers to know the benefit details. See, in my office, just to let you know, we certify with all the plans, and we do it every single year. So we know what plan is offering what's new, what's changed, what's gone away, both on the Medicare supplement world and the Medicare Advantage world. So if you're going to a volunteer counselor and 40% of the time, 40% you're getting accurate information, I just don't think that's where you should possibly be going. Now, look, if any of the information that I've gone over or will go over is of value to you, please subscribe to this channel, because there are some new things coming out with Medicare that you don't want to miss. And if you'll do me a big favor, share this channel with someone that's on Medicare, because they really need to stay informed. Now, let's get into it. Dr. Oz, bless his heart, he's having a birthday. That's great. But here's where an example is from when he was being confirmed by the Senate to run the Center for Medicare and Medicaid Services. That is all of CMS, with the second largest budget in the United States government.
A lot of people Asian. In the opening statements, it was pointed out that we're going to go from 60 million people on Medicaid to 90 million people on Medicaid over the next decade. So I want to ensure and to confirm that I would like to focus on this issue.
Okay, so he doesn't know the difference between Medicare and Medicaid. There's a big, big, big distinction. Here's another one as he's talking about Medicare Advantage and the problems with Medicare Advantage. Now, I'll show you a clip in just a minute where he's selling Medicare Advantage, and it's quite shocking. But then as he's going to be confirmed for the Senate, now he's acknowledging the pitfalls of Medicare Advantage, but again, doesn't know the difference between Medicare and Medicaid.
Because my docs will be so frustrated because they have previously gone through step therapy with the patient.
They're talking about Medicare Advantage, and this senator is also a doctor.
to get them, okay, this medicine didn't work, this medicine didn't work, this one didn't work, now this one finally does. Yeah. They change plans, and they're being asked to go through step therapy once more, therefore giving the patient a valley of lack of response until they get to where they've already know they should be. Thoughts?
Senator Cassidy, that is one of the most frequent complaints I hear from physicians. Patients see it on the other side, which is, I can't get the treatment. I'm in agony, I'm in pain. I really know what works for me, but no one will give it to me, even though I have insurance. Like, I'm part of Medicaid. I'm a beneficiary. I should be allowed to get access to this medication, which I'm told is in the plan, and yet it gets slowed down. This is a place where it's a matter of competency. This is not a Republican-Democrat issue. If we can do the job that's been assigned to us at CMS in a competent fashion and revisit some of the assumptions we've taken for granted for decades, that's being a good one, and use technology that today could help us. Because we have AI support tools, navigation systems that could pretty quickly adjudicate whether you should have to wait even a day to get the medication that will get you out of pain, or even a week for the procedure that you should be allowed to have.
Here's a clue, Dr. Oz. They already are using artificial intelligence in Medicare Advantage. We've covered it many times on this channel, but they're using it to deny claims and save them money. So he came in saying that artificial intelligence is going to save the day for Medicare Advantage and all these denials they're doing. That's exactly why they have it. Watch this exchange.
Or local determinant decisions, or regional determinant decision.
This is critically important. Pay attention to the difference between original Medicare and Medicare Advantage. Regional coverage determination means something is going to be covered or something is going to be denied by original Medicare. And the big fallacy is that insurance agents will tell you is that Medicare Advantage is the same thing and covers the same thing, is the same thing as Part A and B of Medicare. That's a lie from the pit of hell. It's not true. Listen to this.
Local determinant decisions, a regional determinant decision. And Medicare is supposed to cover something unless it is said not to be covered. I'm told that there are MA plans which are reversing that and saying they will only cover something if there is a positive determination that it should be. I'm told this by pain doctors who say, wait a second, I can get the patient back to work, that sort of thing. Any awareness of that? Any thoughts of that?
I'm not aware that that was happening.
I'll bring that up to you.
Nope, not a clue. Didn't know that was happening. So here's another one. This is going to be very interesting. It'll speak for itself.
The biggest abuses are right now in the private insurance sector.
The biggest abuses in Medicare Advantage. Listen to the answer that Dr. Oz has. The biggest thing wrong, biggest abuse in Medicare Advantage. Now they're talking all over the place about waste, fraud, and abuse.
What do you think the biggest abuses are right now in the private insurance sector?
Medicare Advantage sales.
Such as? Well, I mean, give me an example of
There's brokers that get involved.
Not brokers. Oh, no.
Favorite phrases, and I don't get to say it enough, so I'll do it right now, $0, right? We all want things for less, especially if they can improve our health. So here's a question for all of you. Which of these items can you get for $0? Can you get a cup of coffee for $0? Or a pack of gum? How about a newspaper?
This is last year, folks. He got licensed as an insurance broker with a health insurance license only and contracted with TZ Medicare, a massive call center, to sell and pitch Medicare Advantage. This is last year. And he's telling the Senate that the biggest problem is Medicare Advantage brokers.
Vision, dental, hearing benefits, may even include prescription coverage, right? Which one can you get for $0? Right? If you guess these, you're right. Because it's available now for some folks. Believe it or not, it is possible to get health insurance plans now with a $0 monthly premium. Millions of people already are doing it, and so could you.
To the point of the supplemental benefits, enticing people into taking them, that's the short term.
Senate Finance Committee hearing last year on Medicare Advantage and the fact that this is a lawyer who represents seniors who are denied claims routinely all the time over and over and over again. And she's talking about the fact that people come in because of what the brokers are pushing as the most important, the only thing, the all-encompassing best benefit of Medicare Advantage, which is dental, vision, hearing. And that's what he just literally did.
We all have, short-term goals. It's easy to save money at the beginning and to say, I'm going to get these extra things that original Medicare doesn't cover. That's really, enticing for me to take this plan. There might be a low premium as well. But most of us don't think about the larger problems when they're actually going to need help. And like in Ms. Ben's case, they looked and they saw 100 days of coverage. That's what they expected to need when the time came. And absolutely, I would say it's a bait and switch, because you get to that point when you do actually need those bigger things and you're denied.
So it looks like a good plan as long as all you need is like dental or vision. Everybody needs dental or vision. Nobody plans on melanoma, correct?
Correct, yes.
Or on other kinds of acute rehabilitative or long-term rehabilitative care.
Yes, that's correct.
Boy, that's sad. I just don't count on it. Let me just give you a quick perspective on that. Medicare covers you without a network and without restrictions and without prior authorization. But Medicare has a gap where you need to fill it, because you're going to have to pay 20% of all those outpatient costs and a big deductible going in the hospital. If you had a Medigap plan that fills that gap, then you still have the freedom to go to any hospital, any doctor, anybody in the country without a network and without a referral. So a lot of people have to do Medicare Advantage. We're going to talk about the best benefits, the best way you can do that for yourself if you do. But not to beat a dead horse here, but a lot of people are going to say, what? He was a broker? Yeah. Here's his insurance license, which just expired last month at the date of this video. That's right. Here's Dr. Oz as a licensed insurance broker in accident and health and sickness in the state of New Jersey. He also had, until very recently, a non-resident license in the state of South Carolina and all over the country, because he wanted to participate in the sale of Medicare Advantage from the infomercial that he did on Medicare Advantage. Been licensed since 2020. Well, let's talk about this study that just came out. Study showed that a lot of claims on Medicare Advantage are still being denied. They looked at hundreds of millions of claims on Medicare Advantage from many different plans and came up with the results here. Well, what are they? Well, they said that 17% of initial claims are denied. Okay, but read this part. This is the abstract part of the study that's important to not miss. This article quantifies the prevalence of claim denials in Medicare Advantage, along with their direct impact on providers' revenue. Sorry, don't really care about that right now. Employing medical claims data from multiple Medicare Advantage plans covering 30% of the entire market, our study found claim denial rates of 17% as a share of initial claim submissions. We also found that 57% of all claim denials were ultimately overturned. The message here is, don't take no for an answer. The Office of Inspector General study found that over 79% are overturned if you only know that you can appeal. And when they get accountability in there, when the government starts looking over their shoulder, which they're doing now more than ever, thank God, and I'll tell you about that new initiative in just a minute, now it might start changing. But the initial denials, thank you, artificial intelligence, that Dr. Oz thinks we need more of, that's why they have it there, to try to deny claims automatically. Anyway, I digress. We calculated that denials resulted in a 7% reduction in providers' Medicare Advantage revenue. Okay. However, the direct impact of denials could be even greater than this effect that we measured. The article points to an important role that claim denials play in reducing Medicare Advantage spending and in driving outcome differences between Medicare Advantage and traditional Medicare. However, our analysis did not weigh the cost-saving benefits of denying claims. The cost-saving benefits of denying claims. The original Medicare has no profit motive in it. So if someone says you should stay on original Medicare if you can afford a supplement because it's the best possible coverage you can get, they're not lying to you. And if you have a broker that will write you a Medicare supplement plan and explain them and has been doing it for more than 25 years versus somebody who only will show you, and I still argue that more than 90% of agents dealing with turning 65 seniors today will only show the benefits and only talk up Medicare Advantage because it does pay twice the commission. Yes, it does. Here's what the study found. In fact, 21% of the hospital claims outpatient were denied. 17% of inpatient claims, 15% of doctor claims denied, only on Medicare Advantage. But 57% overturned on appeal. Now, the disparities are that if you're non-white, they're more likely to deny your claim. Interesting. I encourage you to stay connected, stay informed, and until next time, thanks for watching. God bless you. Make sure you subscribe. We'll talk to you next time.